Hi, I'm Lauren Cochran, the Director of Clinical Faculty Development at CUNY School of Medicine. In this video, I'm going to walk you through our clerkship assessment form. This is what the form looks like, and if you have significant clinical contact with a student, you may be asked to fill this out. Some of our clerkships have the form online through a system called REDCap. In other clerkships, you may be asked to fill out a paper copy or submit it as a Word document. Our form covers these 12 competencies. There's an asterisk next to procedural skills because these are only assessed in the procedural specialties. And at the top of the form, you can find our global rating scale. If you give a student a 5, we read it as the student is well above expected level in performance of the competency, almost at an intern level. So this is a high bar, but should be achievable even for our third-year medical students. 4 means at or a little above expected level of performance. 3 means at or a little below. 2 means well below expected performance. And if you give a student a 1, that means you have grave concerns about the student's ability to perform the competency in question. Of note, 3 is our lowest passing score. Does this mean that if you give a student a 2, they will fail the clerkship? No. It means that students need to average at least 3.0 across all of their clinical evaluations in order to pass the clerkship. You'll see that each of the 12 competencies has anchor descriptions for 1, 3, and 5 level performance to further guide your assessment. What we recommend is looking at these anchor descriptions and then thinking, what evidence do I have to assess my student in this area? Can you think of some examples from patient care? If you think it over and nothing really comes to mind, then you should select not able to assess. Selecting not able to assess does not hurt the student, it doesn't help the student, it simply doesn't count. So here for medical knowledge, we hope that the majority of our students start clerkships with at least adequate basic science and clinical knowledge, and that they're able to apply knowledge in some clinical situations. That would be a 3. Some students, particularly into the 4th year, like with their sub-internships, will demonstrate a truly exceptional depth of knowledge and be very astute in applying that knowledge. That would be a 5. What if they're somewhere in between? Like sometimes a student will have a really exceptional depth of knowledge, but still be working on application, and in that case you would select a 4. The most important part of the clerkship assessment form is your summary comments, which are at the bottom. The purpose of the comments is first and foremost to let your student know what they're already doing well and how they can improve. The second purpose is to let the school, principally the clerkship director, know what each student is doing well and where they can improve. And I want to start off with an example of a narrative comment that is not particularly helpful. Lauren was a pleasure to work with on inpatient. She was always willing to learn and participate with the team. She should continue to read and develop her clinical skills. We wish her the best of luck with all her future endeavors. And this is certainly a nice thing to say, but if you think about the content of the comments, always willing to learn and participate, should continue to read and develop her clinical skills, we would argue that this comment could virtually apply to any clerkship student and doesn't really give Lauren information about where she's excelling and what she can do as far as next steps. Also, we really want to anchor your narrative comments in those 12 competencies. So here is one best practice approach. Choose 2 to 3 competencies from the form, describe an example that provides evidence for your score, and include at least one suggestion for growth or next steps. Let's take this student as an example. There were a few areas where I selected not able to assess. You see a lot of 3s, but you do see this student earned a 4 for communication skills, and then their lowest score was a 2 for management. So I'm going to select those 2 competencies for my comments. Lauren stood out for her excellent communication skills and bedside manner with patients. One of our adolescent inpatients began asking for Lauren specifically and said she did not feel as comfortable discussing sensitive topics with other team members. We would love to receive this kind of comment. Lauren's differentials were appropriate, but her management plans often lack key elements such as antibiotic dosing and duration or criteria for hospital discharge. She could also challenge herself to contingency plan and articulate a next step if the patient failed to improve with current management. I hope you would agree this gives Lauren some very concrete suggestions for how she can take her management plans to the next level. I hope that was helpful. I wanted to point out that you can visit us on the web, cunymed.org, and then under faculty, you can find our faculty development page. Thank you very much.